Okay, so I'm Dr. Gore, MD, from the Center for Holistic Medicine in Deerfield, Riverwoods. We're a holistic medical center. You'll see in the packets that you have, we treat many conditions, adults, women, children. We have many practitioners, all the way from MDs and DOs to chiropractic, acupuncture, naturopathic, dietary, yoga, meditation. I practiced this way really for almost 30 years. I started out, I went to the University of Illinois Medical School. Then later on I went to Northwestern University Department of Psychiatry. And then I found holistic medicine and apprenticed in it, and with Dr. Rudolph Ballantyne for many years, acquired the practice. And so we've been at our present location for about 15 years. I really feel blessed to do this. Skipping right to the end of the lecture, I feel fulfilled. Why do I feel fulfilled? Because I feel like I'm expressing one of the reasons my soul came to this planet. You know, it's our belief that everyone's here for a soul correction. I'm skipping all the way to the end of the lecture on the outline. So I'm in the process of my soul correction, as I had to zig around a little bit through medical school, through classical psychiatry, through all kinds of different interesting philosophies about holistic medicine, through different kinds of practitioners who want to express themselves. And so now what we have, thank God, is a wonderful center with real, truly integrated holistic medicine. I think this is the way it's going to be in the future. Our vision there is to treat your medical symptoms, teach you about your health, and help you grow as a human being using holistic medicine. And I think that's what this outline is going to show you. Instead of using PowerPoints, I'm going to have you follow along in the outline. I'm going to face you all the time, and we're going to talk. And the outline is really, I'm not an expert in any one thing, how to reduce anxiety or depression. It's more like how to look holistically at your life and how to look holistically at a problem. Yoga philosophy teaches that there are 4 sheets to a person. I'm simplifying it. There's the physical, the energetic, the mental, and the spiritual. So when someone comes in for arthritis, I look at the physical, look at their joints. I look at their diet. Then we might give some supplements, as you know. Everybody knows about chondroitin sulfate. Then we might move to the energetic and use some homeopathy or acupuncture, or breathing like we just did. Then we might move to the mental and find out, joints or stiffness. Are you stiff? What's going on? Is there things that need to change in your life? Are you resisting? So we approach literally everything through these 4 sheets with people. And today we're going to approach anxiety, depression, and fulfillment through these 4 sheets. Okay? Any questions before I go on? Okay. So we're just going to start off with a physical sheath. Now, I'm not going to, this is not an exhaustive thing. I'm just kind of, in 45 minutes, what can I do? So I'm going to run through and tell you some interesting things. Some interesting things about lab testing. Besides the traditional lab testing, subclinical hypothyroidism and iodine deficiency, saliva testing for hormones, and vitamin D is really important. So some people come in with some of these tests. Some people come in with none of them. And so I want to tell you a little bit about it. So everybody should get a basic fasting blood workup. And their thyroid, even though your TSH looks normal, they're saying that the upper level of the normal range really indicates that something may be amiss with your thyroid. And hypothyroidism could be responsible for depression. Hyperthyroidism could be responsible for anxiety. So we look at free T3, free T4. We look at autoimmune antibodies to the thyroid. And I'm looking at iodine because Dr. Brownstein, who actually lectures here this weekend, has been talking a lot about iodine deficiency. And he has convinced me that we live in the Gore belt. The Great Lakes area does not have iodine. And iodine is important for the thyroid gland, but it's also important for breast architecture. It's also important for ovaries and prostate. So now we're starting to see in the clinic a little bit. I had a patient last week. Okay, we diagnosed a little subclinical hypothyroidism. Yes, she has a little Hashimoto's, and all of a sudden she feels a breast lump, and now we're diagnosing, hopefully not, but I think she has breast cancer. So the question is, how does breast tissue, thyroid tissue, how does all this work together? And so this is all important. So this is one of the things that I like to work people up for. Second one is saliva testing and hormones and cortisol. Now, I heard nothing about this really too much in medical school. But I will tell you this, you have to be very careful about, balancing your hormones. You get into your 20s, when you get into your 30s, 40s, even premenopausal, and then you get postmenopausal, you're not making progesterone too much anymore. You're making estrogen, but you're not making progesterone, so this big shift. Dr. Lee coined it estrogen dominance. And, I do a little survey with women, and to find out if they have estrogen dominant symptoms, and anxiety and depression is one of them. And even my wife, and you can meet her down here at the booth, she was saying, I'm feeling anxious. And, I'm a psychiatrist, right? She's a social worker, so what do you think I thought about? Is it the kids? Is it our business? Is it our financial situation? No, this feels something's going on. So we did a saliva test. She was estrogen dominant. different options for estrogen and progesterone. So she opted for bioidentical hormone. So we figured out how much hormone to give her. Then wasn't quite enough because she had some other issues that needed estrogen. So we figured out what kind of estrogen to give her. It was bioidentical. So she's taking estrogen, progesterone. The anxiety went away. I saw that with my own eyes. And it was nothing to do with psychotherapy. So the third one is vitamin D. It's been very fashionable now to diagnose and treat vitamin D deficiency. I just want to let you know this. Don't take unopposed vitamin D, just like I don't recommend you take unopposed estrogen. Unopposed estrogen, especially with a progestin, not natural progesterone, but a progestin, like what's the name? Provera? What is it that has both of them in it? The estrogen, progestin. They can cause cancer and stroke and things like that. You got to be very careful what you take. So when you take vitamin D unopposed, you need to get A with D. A and D in a 10-to-1 ratio. I learned that from Sally Fallon from the Weston Price Foundation. Sally Fallon is here. She lectured. This is a kind of a neat place because all these people are here. So the way I give vitamin D is I give A and D together, and I use cod liver oil. So we use a blue ice cod liver oil, which is a fermented, foul-tasting, foul-smelling thing. But since I've been taking it, I haven't gotten a sore throat all winter. And the vitamin A is really good for women's hormones. And A and D is there in a 10-to-1 ratio. And then I'll supplement people's D, but I will both make sure they get the A on board. So I get people coming with all kinds of amounts of D without A, and I do not think it's a good idea. A to D, 10-to-1 A to D. And because that's why it's found in nature. That's how they discovered it. This is how nature has it. Okay, that's lab testing. Now, you notice how fast I'm going through, because I want to get to everything, and then we can open up for questions. Diet. Now, have you heard about Ayurvedic approach to diet? I mean, everyone's into diet. I did a CD on diet. I know a lot about diet. I lecture on diet. But have you heard of Ayurvedic approach to diet? Okay. Ayurveda says earth, fire, and air. And if you're too earthy, what are you? Mentally. Depressed. If you're too much fire, what are you? Angry and irritable. Too much, I'm saying. And there's too much air, wind, anxiety. Okay. So anxiety is balanced. Wind is balanced by earth, and earth is balanced by air. And I see this all the times in couples. Take a look at couples, how they marry. You'll see this big, rock, solid guy, and this, flitty, flighty, wonderful lady. And they love each other, and they balance it. Because kapha, earth, balances vata. Okay? Now, I'm only talking to you about nutrition here, about balancing these things. So, for depression, Ayurveda says avoid dead, stale, overripe, overcooked, canned, and overeating. All those things create deadness. Now, I like to use an orange as an example. If you take concentrate orange juice and you drink it and you taste it, then over here you slice an orange and you drink it and you taste it. Which one tastes better? Why does the fresh one taste better? It's got the same amount of vitamin C, etc. Energies. There's something different about live versus dead. So if you don't want to be depressed, go live. Make sense? Okay. Over a week, over a day, okay, a few days, a week, a month, weeks, months, years of eating live versus dead, it'll show up in your body and your mind. How are you supposed to fulfill yourself? Remember we jumped to the end of the lecture at the beginning? By the way, the end is always, and the beginning are always attached. This is a Kabbalistic thing. The end is always in the beginning. How are you supposed to have the courage to pursue the life that fulfills you? Because it just doesn't come naturally. That's part of the soul correction that we're going to talk about. You have to work through it. You have to work over the resistances and uplift your soul and then fulfill yourself. Well, how are you supposed to do that if you're eating dead food all your life? It's harder. It doesn't mean you can't do it, but it's harder. And that's really why holistic medicine exists. We're going up the doshas here. We're going up from physical to energy to mental to spiritual. Well, all holistic medicine is designed to support the spiritual growth. And I told you, our vision was treat your symptoms, educate about your health, but help you grow. Why? Because this medicine isn't just here. It's not just my job to get rid of your pain. It's part of my job. The job is to help you grow. You didn't come to Earth just to have pain and get over it. Did you come to Earth to learn that a banana was healthy and eat it? That's what a monkey does. And if you do that, the animal part of you, which is a good part, does that. But the godly part of you came here for a different reason. Okay, Ayurveda. Then cholesterol. Cholesterol is good. There are studies that show if they lower your cholesterol below 150, you get depressed. 140, I forgot exactly what it is. Don't let them lower your cholesterol. Is any women in this audience? You go in, you type up cholesterol, mortality, and women, and you will find the higher your cholesterol, the longer you live. This is a big myth about cholesterol. We're in the middle of changing it. Doctors know it. They know that statins really are not the right way to go. This is a whole lecture in and of itself. There are limits to everything. But right now, cholesterol has been a taboo and a bad word. Do you know that cholesterol, your brain is 60% cholesterol? What happens if you lower it? Cholesterol, all your molecules, let's see, there's progesterone goes to DHEA. Pregnenolone goes to progesterone. They make DHEA, they make testosterone, they make estrogen, they make cortisol. All those beautiful hormones. What do you think the first molecule is? Cholesterol. Cholesterol makes all those things. If you lower it, you're making it hard for yourself to make hormones. Now, this big vitamin D deficiency thing. How do you think you make vitamin D? Cholesterol. It's cholesterol. Nobody talks about it. The sun shines on the skin and changes the cholesterol molecule, runs it through the kidney. Do you know that? Nobody talks about that. Let's lower your cholesterol. But what about your hormones, your vitamin D, your brain cells? Okay, don't get me off on that subject. Any one of these subjects I can launch on, unfortunately, so I got to keep myself disciplined here. Now, I'm going to tell you something I just learned yesterday, which is really cool in terms of food. Sugar and protein increase insulin. When you increase insulin, insulin gets rid of all the amino acids in competition with 5-HTP, tryptophan, which forms serotonin. Well, hold on to that for a second. We're going to go into the supplements now, okay? We finished sheets, the physical health. Now we finished diet. Now we're into supplements. So I want to say that increasing neurotransmitter activity, that's what you think about in supplementation. The theory is a reduction in brain levels of norepinephrine and serotonin is the cause of clinical depression. So we want to increase these things somehow. So the first one I have on here is 5-HTP. It's an amino acid. You take the amino acid and you make serotonin with it. A little trick is if you take a little sugar inside, the sugar, see, since 5-HTP is an amino acid, there are many other amino acids, and they're all competing to get into the central nervous system. So it turns out when you have a little sugar, it makes insulin, and then the insulin gets rid of the competition of all the other amino acids and allows the 5-HTP to go into the central nervous system. Now, I didn't know that until yesterday when I was reviewing some notes on a lecture I was at. So I'm thinking now, instead of just giving 5-HTP, I'm going to think about how to give it with a little healthy sugar to do this. L-theanine increases dopamine and norepinephrine. L-theanine is an amino acid. So a lot of times we'll give someone who comes in with mixed anxiety and depression both 5-HTP and L-theanine. Inositol is a B vitamin. I'm not sure how it works. I talked to our new naturopath the other day, and she said it also affects serotonin and epinephrine, but when I looked it up, people were a little confused about it. But inositol has been fairly harmless and has helped people. Vitamin B6 and C are involved in both norepinephrine and epinephrine production. So it's important to make sure you have your B vitamins and vitamin C. Now, there's ways to do all these things. I can't really talk about them here. But, you know, for instance, do you do natural C? Do you do synthetic C? Same thing with the B vitamins. Do you do just B6? Do you do all the B vitamins, etc.? That's why it's good to have a healer. This is an overview lecture to let you know that all these things exist. Okay. Exercise. Exercise. Endorphins reduce pain. Does anybody here exercise to make themselves feel better? Okay. Several people do. Well, when you exercise, you increase endorphins, and the endorphins affect receptors in the brain just like morphine. Now, when I put this on, I was thinking of aerobic exercise, but I'm also thinking of stretching exercise. Do people stretch here? If I had a little more time, I would stand you up and stretch you around. Or if I thought that you were exhausted by my lecture, I would stand you up and stretch you around. We just started, so I'm not going to do that. And we're already halfway through. But having some kind of daily stretching, daily aerobic activity is very healthy for the mind. And so what I do is I try to do it. And, you know, my staff knows I try to ride my bike. So I get 15 minutes one way, 15 minutes. At least by the end of the day, I've got 30 minutes of exercise under my belt. You know, in this seminar, instead of just sitting all day, try to get up and walk a little bit. We teach something called joints and glands, which is a gentle little yoga stretching exercise. You can make an appointment with Bea. She's a great lady. She'll spend an hour with you teaching this stuff, an individual. You can spend 2 or 3 sessions with her, and you've got it. Take home. So, exercise. Now, the energetic sheath. So that was all physical. See how I see things? All of that was on the physical sheath. Diet, supplements, exercise. The primary way in was the body. But now we're going to do something else. The primary way in is the energy body. Now, what is the energy body? Have you ever heard of the energy body? You know, different people, I mean, you're preaching to the choir here a little bit, so, but and they don't teach this in medical school, obviously. Maybe now they do, but I still don't think they do. No? So there's an energy body. And, you know, I feel tired. I mean, I felt crummy last night. So what did I do? Here I am skipping ahead again. I went to homeopathy and I took a dose of aconite. Aconite is a homeopathic remedy made of energy. You can take the plant aconitum and dilute it 1/10 to the 200th. So your mathematicians here can figure this out, that if I had a board, I would write out 200 zeros in the denominator. There's no molecules left of aconite. So what is it? It's energy. It's amazing. It's energy. Does anybody not believe that? Does anybody believe it? Okay. Most people. When I started homeopathy, I did not believe it. My teacher had to convince me to do it even though I didn't believe it, which I did. I did do it even though I didn't believe it. I saw kids get over ear infections. I saw asthma improve. Headaches go away. Depression. One woman came in with postpartum depression. I gave her a dose of pulsatilla, and I've known her to this day because of it. And then at some point, I believed it. You know, a belief system changes from experience. If you just believe something rotely, I mean, I have a hard time believing things rotely. I need experience. Okay, so that was homeopathy. I skipped ahead on homeopathy. But breathing is the same thing. Now, when I had you guys breathe before the beginning of the lecture, I'll tell you what, take a second now and just focus on your breath in your nostrils. And I'll do it with you. Watch me for a second. Most times, the breath is stronger in one or the other. It's lunar, left side is lunar, right side is solar, parasympathetic, sympathetic. But right now, I want you to imagine both breaths come out and both breaths come in together. Out through your nostrils and in through your nostrils. Just imagine that for a little bit. And I'm going to ask you a question. Here's the question. Is the breath coming in cooler? Is the breath going out cooler? How many people say in? Raise your hand. About half. How many people say out? Raise your hand. Okay. Are there any other choices? All right. Okay, let me try this one. Which breath is more humidified? The breath coming in or the breath going out? Who says out? Raise your hand. And who says in? Raise your hand. Okay. Now, open your eyes, but stay in touch with your breath. Your breaths are going out and going in. You can feel that through your nostrils. That's why we eat a certain way and do a neti pot. We do all this preparation just so this moment we can sit here together and have our breath going in and out unimpeded. As you feel your breath going in and out, your consciousness is shifting from an amygdala, animal consciousness, fight or flight response, the world is terrible and everything's happened to me and nothing's going to work out right, to prefrontal lobe consciousness, where the godly soul in me, whatever you want to call it, the higher part of me, is in control, and I'm using all these challenges to make lemons into lemonade. All from the breath. That is anti-anxiety. This is a free anti-anxiety technique. This is a free antidepressant technique. We teach people with panic disorder how to do this with the nostrils. There's another technique called 2-to-1 breathing, where you emphasize exhalation over inhalation. For the ones who are depressed, there's something called Bhastrika, where it's an active exhalation. Things like that. So these are techniques, yoga techniques, that are very practical that we have brought in to teach you to empower your own health. Any questions? Okay. I mentioned homeopathy very quickly. I want to mention it again. I have a couple of examples of remedies here. Ignatia is made from the ignatia bean. Homeopathy is plants, minerals, animal substances that are then diluted with alcohol and water to bring out the medicinal energy in it, and then either directly given to you or put on milk sugar substrates of little pellets and pills so you can carry them. The diagnosis is made on the symptoms that you present with, and the choice of the remedies are made from something called the Materia Medica, where we look in a book, and the book has many remedies, thousands of remedies. It's become so popular now that they have made computer programs. The computer programs have been around 20, 30 years already. There are courses. There are colleges. There used to be a college of homeopathy in Philadelphia. There were several of them, medical schools in Britain. The Queen's personal physician, I don't know how many she has, but one is a homeopath. I met him several years ago. So homeopathy is really around, and it's not going to go away. It takes a lot of time, because what happens is we have a homeopath on our staff. She practices full-time. She sits with you an hour and a half, and she asks you things like, are you thirsty or thirstless? Are you warm or chilly? Now, you come in with anxiety, but you're warm, messy, and handy, and you're a pack rat, you get the homeopathic remedy sulfur. But if you're chilly, restless, like hot drinks, sip them all day long, perfectionistic, walk with a gold cane, upright, and like to give orders, you get arsenicum. You're two people who are anxious. They don't get Xanax. They don't get 5-HTP. One gets sulfur, and the other gets arsenicum. Isn't that cool? But it takes a lot of time to do that, a lot of knowledge and experience, and I think that's one of the reasons why homeopathy doesn't appeal to everyone, because it's a love. You have to love it. Now, you have Ignatia written down there. Ignatia is called a funeral remedy. Someone gets upset, not so much anxious or depressed, but upset. Ignatia is a great remedy. Someone died. They got a diagnosis of cancer, God forbid. 9/11, the day that 9/11 happened, I was giving out Ignatia left and right. And what it does, it really quiets down. You know what it does? I just realized it right now in front of you. What it does is, again, just like our breathing shifted our consciousness from the amygdala to the prefrontal cortex, that's what I think Ignatia does, or a good homeopathic remedy. It brings you back to yourself. There's selfhood. You need to have selfhood. Why do you want selfhood? Because that death, 911, is an opportunity to grow and learn. It's interesting how I'm doing this lecture. I keep coming back to that because all parts are connected to the end. Everything is about growth and development. So the medicine that we're trying to give you is a medicine that doesn't get in the way of your growth and development. At least it might be neutral, but it might even be helpful. Imagine taking a medicine that's helpful. I used to give my kids, they were trying to, they were crawling around and had dripping with infection, so I'd give them a dose of whatever, pulsatilla, or I would give them calcarea carb or something, and all of a sudden, the cold would go away and they would stand up. I can't tell you how many times I saw kids get sick as a manifestation of a resistance to a developmental step. You give the right homeopathic remedy, the illness goes away, the tooth comes out. They say the first word. I don't practice pediatric homeopathy anymore too much because my kids are now grown. Now I practice 20-something psychology and homeopathy. But when I did this, there were no pediatric homeopaths around. I had to do it, and I saw all this stuff. Okay, and then the next one is flower essences. They make remedies out of flowers. I want to read a couple to you. We had a lady that lost her father, and she was never able to cry. So he gave her the flower essence Star of Bethlehem. I'm going to read this to you. It's a deeply restorative remedy with calm, soothing properties for people who have experienced shock or trauma. It is particularly helpful for individuals who have never adequately addressed a disturbance from the past. Such persons often seek to anesthetize the trauma in inappropriate ways, such as drugs, occult ritual, or numbing of awareness. There's a longing and seeking for a part of the spiritual self which seems inaccessible. That was Star of Bethlehem. This whole book is full of remedies for the mind. One of my favorite ones is walnut. I give walnut for context shifts in a person's life. Well, I better get going here. The human soul is akin to a plant in its patterns of growth. It grows slowly and almost imperceptibly from day to day. But there are moments when it makes radical metamorphic shifts, moving beyond its current form to something utterly new. The plant transforms from root to shoot to leaf to flower to fruit. Walnut is an important remedy for times of great life transition. Has anybody here went through life transition? It assists the soul in making metamorphic changes indicated for life passages when the self must be completely and irrevocably transformed in order to continue its evolution. If the mind experiences doubt or confusion, the progress is impeded if not imperiled. So it's used for, it's helpful for those who may be easily influenced by family ties, community mores. Community mores, what an interesting thing. Social conventions. I'm stuck in this social convention. I need to do something different. Strong personalities or past habits, and who are unable to muster the strength to make a break with the past and with the ideas of others. It's especially power in the mental field, helping to dispel any enchantment, illusion, or spells, and it can be broadly applied to valuable life transitions such as birth, death, moving, career changes, ending or beginning relationships. Pretty cool, huh? Flower essences. One of our practitioners had surgery recently on his eye, and he was feeling upset about it. And we gave him walnut, and just calmed down. Took an edge off. He was kind of shocked about it, how well it worked. Well, flowers, they prepare a little differently. They put in water or alcohol and let them sit, where homeopathy is shaken and percussed. But I have to go on because I'm just seeing I just have less than 10 minutes and I have 2 sheets to go through. Okay? So I'm going to leave the energy sheath onto the mental sheath. The mental sheath is a way to reduce anxiety and depression also. So there's traditional talk therapy. So here it goes. I'm in a job, and this guy is torturing me, the boss. I go to my therapist, and I remember being tortured. I remember being threatened by my father. I remember being threatened by my mother. I remember being threatened by an uncle or an aunt. And my gosh, by bringing it to my consciousness now, I realize that this boss is not my uncle, my aunt, my mother, my father. He's just a guy having a problem. Freedom. I've just reduced all my psychiatric training into one sentence. It's a little more complex than that, but basically it's that. And we have techniques to have your adult comfort your child no matter what happened in your past. Wonderful techniques to split your child off from your adult, because that's actually what happens. Whether you know it or not, you walk around a lot as a child, looking like an adult, which isn't very functional sometimes. So we teach you how separate that out, articulate it well, and then really make friends with your child. Your child's never going to go away. My opinion, your child will never in your entire life go away. You have to learn how to relate to him, to her and him. Okay, then there's energy therapies. Daniel Levy with us, you hold acupressure points and you go through certain things. This happened to me, it's not happening anymore. I can forgive the person who did it. All the etiologies, everywhere in my body, mind, it's gone. There's a whole thing. It's called Tabian acupressure technique. Another one is emotional freedom technique, where you tap on these things. It's not so much talk therapy as it is energy therapy, because you're combining meridians with articulation. The third one is a somato-emotional release, where our DO, doctor of osteopathy, who's an internist, and she's also trained in the mind too, she's actually working on different chakras, stretching the body, while Daniel is working on a particular conflict. So I saw a patient who was abused. He was sexually abused, actually, and they were working with him, and one would be working on stretching out a chakra, and the other one would be working on talking about issues, and it's really powerful. That's called somato-emotional, releasing the mind from the body. The final one is a simple journaling one. You know, you can take a journal and you can write. I'll have patients, no, I don't want talk therapy. They're comfortable with me seeing me as a regular doctor. I do both. And as part of their session about their thyroid or about their menopausal symptoms or about their arthritis or whatever, we'll go over their journal. And they'll bring in their journal and they may have insights. And there's some people who don't want this, don't want this, don't want this, but this works for them. And that's what's so great about holistic medicine, is because we can find something that works. Okay, I just whipped through the mental sheet. Did a disservice, I'm sure, but at least you heard about the things. Now on to the most important thing, which always gets the least amount of time. You have about 5 minutes for this one. Spiritual sheath. Prayer, contemplation, and meditation. Where I was training, this is the 3 main methods they talked about. All I want to say about prayer is that the older I get, the more I realize the less I control. I've never said that before out loud like that. The older I get, the more I realize the less I control. Now, they talk about it, I've read about it for years, but now I really feel it. I feel it every single day, and one of the ways I overcome it is with personal prayer. I make up words, I talk to God, and it's wonderful. Make up your own prayer. I've had to convince certain patients, don't worry about the liturgy. I like the liturgy too. I've had to study the liturgy, and I have to figure out what the sages meant by this word and what they meant by this word, and it's amazing what opens up when you do that. But there's also a place for your personal prayer. So, what I mean by that is you literally make up your own words and talk like you're talking to the best friend in the world. And after 2 or 3 or 4 days of it, it gets real easy. Number 2, contemplation. Ideas to study, to think about. Number 1, what does life want from me today? I got this one from Viktor Frankl, who went through the Holocaust, logotherapy, and he said the only way they survived in the camps was to turn things around and say, not what I want from life, but what does Spirit want from me? Right now, this second, while that guard's standing there, what can I do? What does I want? Now, the next 10 minutes, what do they want? So he realized that what my purpose in life, and this is beautiful, is shown to me. It's brought into me as I live. My purpose right now is not to be a doctor. It's not to be a husband. It's not to be a father. It's to be a good lecturer. But that's going to change as soon as I walk over to the booth. Your purpose in life changes because life shows you what it wants from you. I want you to think about that and contemplate that and look at it and see how it works. The next idea is security. If you're anxious, I asked a really knowledgeable rabbi, what makes you feel secure? And he said, in the horizontal or the vertical? I said, in the horizontal. He says, I feel secure when I'm giving. I thought it was one of the greatest answers. And there's also some other ways to get at that. I thought about that a lot, and I feel like it's true. There is no security other than giving. There's no static security. Give it up. It's not going to happen. We're not made to be static. We're made to give and change and do our soul correction. I'm glad you can't argue with me because there's no time, see? All right, the third method of contemplation is, I love this one. I really love this one. What is your unique contribution that only you can give the world? The whole world is a puzzle of pieces, and you have a piece. Your soul has one piece, and if you don't do your piece, it will never get done ever. That's what the traditions teach. No one else is going to come and do your piece. I don't care how big, how smart, how rich, how whatever you attribute to them, they are not supposed to do your piece. There's no sense envying them because you have your piece. There's no sense I'd rather be like them. I'd rather have what they have. No, you're supposed to have what you have. You're supposed to work where you work. You're supposed to work through your place because your soul correction is unique to you, and you are obligated to do it. You think, oh yeah, I'll watch the Bears today and not do my soul correction, which I do a lot. My wife kills me about it. Obligation. There's something called obligation. This is an amazing concept. You're obligated to grow. It isn't a choice. Oh, I want to grow. Oh, no, it's too difficult. You're obligated. And what is it that you're obligated to do? To fulfill yourself. To fulfill yourself by doing your destiny that only you can do. Not your daughter, not your son, so you have children and then worship your children. No, it's not about worshiping your children. Being respectful, helping them launch. It's not about worshiping your parents. It's being respectful. You have an obligation to fulfill the reason why you came to this earth. And only you can do it and nobody else can do it. And that's your contribution to the world. So meditation can help because if you sit and you focus on something, and we just did it with the breath, but if we kept on doing it, I could have had you empty your minds completely, and then you're sitting there in awareness, and when you're sitting there in consciousness and your mind is empty, you move closer to the source. Now, it's really important to understand, when we teach meditation, I want you to understand this. The goal is not to move so close to the source that you leave the earth. Why bother being on the earth then? You might just stay up in heaven. Why bother being on a mountaintop? That's only for a few that are supposed to do that tradition. The rest of us are supposed to learn how to be still, quiet the fight or flight response, let go of all the craziness in our mind, connect up to our higher self, and then help somebody, help something. And that whole process that I just described is a soul correction. And if you do it, my suggestion is that you'll be fulfilled. And that's why I didn't want to just label this goodbye anxiety and depression, because what do you do then? What do you do? Go watch the White Sox? Go watch the Cubs? I'm picking those on purpose, you guys know. They're like 9 and 14 games out or whatever. You're not going to go watch them. The purpose of not having anxiety, the purpose of having joy, the purpose of being happy, the purpose of having a healthy body, a healthy energy body, thinking properly, knowing how to think, having a good philosophy is to fulfill your destiny that only you can fill. Because the world needs you to do that. Okay? All right, how much time do we have for questions? A couple minutes? Okay. Any questions? On anything? Yeah. Okay, question is, can I review what I said about the 5-HTP? 5-HTP is 5-hydroxytryptophan. It forms serotonin. Serotonin is a transmitter. You know, Prozac and Zoloft, they all work by increasing serotonin. So we want to increase serotonin. So it turns out that tryptophan, which forms serotonin, is an amino acid. It has to get through the blood-brain barrier. Now, what if, can you stand up? Here's a serotonin molecule, right? I'm the blood-brain barrier. I'm going to recognize her if she's just standing up, right? Now, what, would everybody stand up, please? All right, I'm the blood-brain barrier. Where is serotonin? Where is serotonin? So you take a little sugar, and it increases insulin. Now, everybody sit down with you. No, you don't sit down. Everybody else sit down. This is what happens when you take a little sugar. It knocks out the competition from all the other amino acids and leaves serotonin to go into the blood-brain barrier. Is that cool? So now you all have an excuse to eat sugar. Better be careful, because when we get people to lose weight, we give them fat and protein and long-acting sugars. So I have to figure out, what do I do? Take a person, give them a little maple syrup, give them a little honey with it. I have to think about how to do this. But I wanted to let you know about that. Any other questions? Too much sugar is bad news. It's a bad thing. Too much insulin. We are in an epidemic of too much insulin. We're seeing inflammation, heart disease, and cancer, and it's a lot due to that. Anything else? Yes.
I like your comment about light shows you what it wants.
Yeah.
And I have trouble differentiating being buffeted by everybody's desires and
Right. So the question is, how do you stay on a course with what life shows what you want? How do you know? Isn't that the Lord, that prayer where show me the way and give me the courage to do? So how do you do show me the way part? Well, I have 0 time left, so that's a great question, and we'll just stop right there, okay?